Well, good morning, everyone. And I think I'd like to start actually by thanking our mayor. 2 years ago, he took the courageous step of announcing at a State of the City address the intent to create Health City and had the courage to allow the ecosystem to actually determine what that would be and how that would work. And it was a really unique opportunity where Health City as an entity, as one voice, can work directly with Executive Council at the Mayor's office to really move a really unique agenda item forward. And that took a lot of cooperation from EEDC and other players for everyone to say, all right, let's see what you can do as an ecosystem. And I just want to thank the city for the courage to allow us to do that, because it has allowed us to shape it in a way that is pragmatic and meaningful and engaging for so many different players who are represented at that table. And for those of you who maybe weren't at the beginning of the Health City journey, it started with a creation of a vision of how could our ecosystem act as one entity with one voice, moving in one direction under one vision, both for the Edmonton metropolitan area, but also to set a tone really across the province for what health innovation might look like in our future, in a way that it was different, in a way that was going to be difficult for others to replicate, and a way that was going to be relevant not only for Alberta but also relevant internationally. And so that set a vision for how that might happen. And when we first started meeting with outside players, they were really fascinated by this idea that a municipality would host a table that included provincial-driven healthcare organizations, academic universities, industry players, and even outside players from other jurisdictions to help guide that, and that it could set a path and define a vision as to where it was going to move forward. And the first year, led by Jody Abbott and Dr. Bob Westbury, was really about trying to determine what that vision would look like. And to articulate in that in a very simple way, here's what we heard from all of you. We need to improve access. We need to improve navigation. We need to improve capital. We need to improve our data capability. But more importantly is we needed to act with one voice. And so part of that is why we're here today, because we set a vision. That vision turned into a business plan. We held a summit where we announced that business plan and went through that business plan with this room. And now we have been actually executing on that business plan. And I know for many of you, this is the first big touch point where we've come back and said, where are we on that path? And I think, health, nothing moves incredibly fast in health. I'm in the health sector, and I love the fact we've made some great strides. There's other policy issues that do take time. But I think, we were having this conversation right at the table just before we came up, that one of the fundamental changes that I have seen is when we started this 2 or 3 years ago, people asked, why are we doing this? Why is it relevant? Is this something we should be doing? That conversation has now shifted to, no, we believe this is the right vision. People are aligned. It's really now into the how are we going to do that. We have some very unique assets in this province that are very difficult to replicate in other jurisdictions. We need to turn our integrated health system, instead of into an expense line around the service delivery of healthcare, but instead shift that into one of North America's largest development platform for health innovation, where in a very unique way, there only needs to be a handful of people at the table to allow access to a provincial level development platform. That's a really unique opportunity. Our data is a really unique opportunity. The fact that we don't have massive amounts of competing academic interest in the health innovation space is actually a huge opportunity, because it allows us to work together with one voice without a lot of competing interests at the table. And this is a very unique jurisdiction to do that. And maybe I'll talk a little bit about some of the progress that we've made on a couple of those things before I turn it over to Reg. So on access, one of the things we heard is, how do we access this big health platform? AHS has come an immense way in terms of finding new ways for you to access that system. So they now have Pathways to Innovation, which is a team embedded within AHS, whose goal it is to scale and to try new technologies. I see Justin's joined that team along with Mark Leduc and Catherine, and is available to answer questions about how you do that. But that was a real critical thing. What we heard is that, you know, we heard lots of words like, how do I sell to AHS or go through the procurement exercise, not a co-design and development exercise. So that's a massive shift in conversation to now we're talking about co-development, co-design. How do we embed AHS in the development path? And we are building products not to sell AHS, but products that AHS and we can sell the world. That's a fundamental shift in how we think now. Things like the creation of new accelerator space. So I was even over at Concordia, who has now developed at Concordia wet lab space and is looking for commercialization partners to enter that space. We have new wet lab space at Tech. We, as DynaLife, we created an accelerator in our facility and are moving diagnostic companies actually into our space who are able to use our staff, our expertise, and our resources free of IP, free of equity issues, but it's truly a community development exercise where we feel we can help and participate in that. And I think there are so many examples that are starting to develop where both public sector and private sector agencies are now stepping in to look down and try and figure out how to say yes to the SMEs and actually help them take that first step and help them up. For navigation, we have new tools and resources to help SMEs connect. You know, it is a tremendous ability for when you speak to one of the Health City team, the amount of connection that we can immediately create for players from outside their jurisdiction or inside their jurisdiction. And there is an automatic assumption that someone is going to pick up the phone on the other side and start with a yes conversation instead of starting with a why not conversation. That's also a big shift. In terms of data, there's been, you know, the Mayor spoke a little bit about the Smart City Challenge and how we're looking to leverage both municipal data as well as social economic data and inclusive with our health data. But many of you may not know that we've actually opened up new data portals through IHE. And those are not just for the big M&Es and those are not just for the big players, but there is actually programs for small SMEs and small businesses now to go through IHE to get access to that massive data platform. That's also all new space, and space that people aren't even aware they can leverage yet. In terms of capital, we have brought players in, even in the cannabis space, we have brought players in to invest in local healthcare companies coming from licensed producers, players like Emblem, who bought into DriveAble. Aurora has made investments, and we have lots of people looking at how we can potentially use our data and our real-world evidence platform for medical cannabis development. So that's another, I think, huge opportunity that's on the horizon. So it has been a journey now of execution. And I think my call to action for this room is no one else is going to come solve our problem, right? Again, this room is the solution to the problem. And the more we collaborate, the more we speak with one voice, the more we leverage all of our collective assets, we need winners. It's not good enough to just count how many shots we took. We need goals. And ultimately, when we talk about talent and we talk about attracting capital, money is smart. Money will go where there is advantage and opportunity. And we need to create a jurisdiction that has the most advantage and the most opportunity, and money and talent will come to that. Otherwise, we can invite them for as many dinners as we like, but no one's cutting a check. And so really the focus for the next window of time, for the next couple of years, we know where we need to get to. We know what it needs to look like. I think we have a very articulate vision. What we need to do and what this room needs to do is execute on that. And the great news is that because we have something like Health City, we have a vehicle collectively to do that. And that vehicle represents industry, it represents the public sector, it represents the private sector, it represents big companies, it represents small companies, but it represents all of our interests. And it's my pleasure to introduce the guy who has the responsibility of taking us through that journey over the next couple of years. But again, this is our opportunity, this is our challenge, and collectively it will be our win. And so my call to action is find the way to say yes, find the way to collaborate, find the way to help whoever's asking that next step. And that is probably the most powerful thing that we can do.